Good morning, it's Angie Oliphant from Eden Medical Retreat, Lombok. I just wanted to talk about substance abuse and the effects that it has on families. It's an intergenerational effect that can affect children. Australia, of course, has had 69% of all domestic violence is due to substance abuse, whether it be alcohol, which of course in Australia is not looked upon in a demonic way at all because it is a legal substance. But in actual fact, we've just had a murder of 3 children and the mother due to domestic violence, and whether or not that gentleman was just mentally unstable due to the separation or whether he was on substance. But substance abuse is contributing to a rise in domestic violence, and it really is a tragedy, and we need to start being able to address the problem. And this crosses across all cultures in Australia, whether it be Caucasian, Middle Eastern, Indigenous. We have a problem, and somehow we need to start programs within the schools to prevent domestic abuse, which is resulting in 1 woman a day dying from murder from domestic abuse. Now, substance abuse is more our specialty, and I will get into that. The fact of the matter is that substance abuse occupies a significant place in Australian culture and is consumed in a wide range of social circumstances. Australia's substance use remains high by world standards, and it's not acceptable, and we need to do something about it. It is destroying our society, and slowly but surely it's eroding the family boundaries, and we need to change that. And we must start looking at substance abuse as a disease and treat it accordingly, and it is a specialised field. So I wanted to talk about the fact that 44% of Australians reported that they've been negatively affected by other substance abuse related behaviours. Now, that may be parents, children, grandparents, friends, whatever. It really is a terrible situation. Already through substance abuse, 15 deaths and 430 hospitalisations occur each day across Australia due to substance abuse, whether it be alcohol, methamphetamine, heroin, whatever the choice of the poison is. It's affecting our society, and we need to become very proactive in stopping this. And it is the children. These are the silent victims of abuse from domestic violence and also from substance abuse, whether it be alcohol or drugs. 22% of Australian children are estimated to be affected in some way by the substance abuse problems of others, and over 10,000 Australian children are in the child protection system, the Department of Child Protection, because of carers' substance abuse, which is parents, etc. So most of the women that we're treating here are losing their children due to their abuse, which is from methamphetamine. This, of course, is tragic for the family and for the children, and you know there's many reasons for this that occurs. So I would like to talk about that. Risk factors for substance abuse in parents is often caused by a traumatic childhood. Substance user parents may well have experienced traumatic childhoods themselves. They may have suffered from sexual abuse. They have poorly developed coping mechanisms. They take the substance to reduce loneliness and depression and feelings of isolation. Self-medication of underlying mental health issues. At Eden, we believe in dual diagnosis, and a lot of our patients actually have got pre-existing psychiatric conditions such as borderline personality disorder, paranoid schizophrenia. A lot of these are exacerbated, not the borderline personality, but the paranoid schizophrenia by the methamphetamine abuse, and they do develop psychosis, and we need to be able to handle that and teach people how to withhold themselves from taking drugs, because it is catastrophic to their families and to themselves. It affects their own organs, their own brains. They do suffer flat affect personalities sometimes if their use has been high, and they do have depression, and we do have high suicide rates from people taking methamphetamine and drugs. So, they do also, the parents take substance and they're at risk, and they might be doing this to gain control and to improve self-esteem and self-confidence and self-empowerment. Instabilities within the households also can cause this through divorce, parental mental health issues that may be undiagnosed, and the children, of course, are subject to that. Frequent undesirable changes in the family life, which is due to not being stable in work and employment, and they have financial difficulties. Frequent job and business changes, and frequent relocations. I wanted to talk about impact of parental substance use on emotional and behavioural issues involving children. And this is very important because they do get situations where studies have shown that children from homes with parents with substance abuse demonstrate increased conduct disordered behaviours with lying, fighting and truancy and impulsivity. And we've actually had a child who we treated his parent for her drug abuse, and what we discovered was that the reason he was a truant was because from school, for the past year he hadn't gone to school, was because he couldn't show his emotional instability or distress in any other way but through truancy, and we've now addressed this. We do use a behavioural specialist and psychologist by the name of Dr. Leith Cracker, who does fly to Australia and does treat the children and does a marvellous job in assisting them in getting back together with their families and also to recover themselves from the damage that they might have received due to their parents' abuse through drugs. And this is really important. So, common emotions observed in children is guilt for being unable to care for the parent, and also anxiety, worrying constantly about abuse and health issues and finance and housing, embarrassment related to the way that the parent behaves in public, fear of intimacy, inability to trust people, and confusion due to inconsistent parental behaviour and environment. They do get angry and get frustrated, and that can be directed towards enablers in the family. Depression and a sense of despair and hopelessness and helplessness. Parents' resiliency in overcoming substance abuse is the best form of treatment. And we do encourage people at Eden, for the parents that have been suffering substance abuse and have had a long-standing addiction to the drugs, we encourage them to have strong communication skills. We teach them how to increase their self-esteem and their self-worth, and to actually like themselves and to forgive themselves for their past and to move forward. And that is a really important thing, that people are allowed to move forward. We all are human beings, we all make mistakes, and I believe every addict is salvageable, and that's what we're doing at Eden, and we're doing it very well. If any of you need any answers, please go to our website, which is edenmedicalretreat.com, and you can speak to us, myself, Angela Oliphant, or as the director, or you can speak to Dr. Liz McIntosh in Queensland. Our telephone numbers are on the website, so don't hesitate to go there. If you need any assistance with getting someone treated in Melbourne, we have got people on the ground that will actually get involved in intervention with you, and none of our patients are not escorted to Lombok. So if you're in Melbourne, I have a trained support worker who will fly, Billy, with the clients from Melbourne to Lombok, and they will be safe, and he will take them through immigration, and it's a great assistance because it makes people more comfortable about the journey ahead. In Perth, I also have people on the ground that will transport and escort patients from Perth to Lombok, and we also get them escorted back to their place of origin. We also offer support post-discharge from Eden here, but we also have support counsellors in Victoria and Western Australia and Queensland with Dr. John McIntosh, who's our partner in Eden Medical Retreat and Dr. Liz McIntosh in Mackay, and they are readily available, and they are working very hard to prevent suicides in Australia and globally. So if you've got any questions, please don't hesitate to call us. We are here to help, and wherever there's a problem, there's a solution, and we believe that you should talk less and do more. So I implore you to give us a ring. That is the first step in your family or yourselves in your recovery. Thank you very much.